I'm about to have an antibody test. It's very, very quick, a COVID-19 antibody test, and then we're going to talk about its significance. So I've got a finger ready, which is going to be pricked. I'm going to try not to be completely weak and hopeless and go, ouch. Here we go. Ouch. I'm lying. She hasn't done anything. She has now. Okay. This is something that we're going to be talking to you about in our Corona Hope feature. Dis-Chem is running a promotion, I think you'd have to call it, where they have drive-through testing for antibody tests. Of course, the big question is, what does it show and why would you do that? And that's coming up in a moment. I've got with me Ansie Hartman, who is the Clinic Regional Manager at Dis-Chem. And Ansie, you can just tell me briefly, speak as loudly as you can. I'm going to push the microphone your way. What exactly are you doing to me? And why, more to the point?
Like the reason why I'm doing this is we see a lot of people outside in the country that are asymptomatic, and which we don't know if they had COVID or if they don't. So with the antibody rapid test, you can quickly pick up if you were exposed to COVID, if you had COVID without any symptoms. This will tell you that if you were in contact or if you had COVID, your body has recognized that virus and he has picked it up and he has made some antibodies to protect you and to when you get in touch with someone that is COVID positive again.
So the antibodies tell us what? Because from the little bit that I've read, antibodies, particularly if you are asymptomatic, do become increasingly undetectable. Would that be correct?
It will deteriorate over time.
Right.
But within 14 days, you will still be able to see if you had COVID and if your body still have the antibodies.
How long is it going to take you?
10 minutes.
10 minutes to tell me if I've got antibodies or not.
Yeah.
So I had a positive COVID test at the end of June. So that's quite a long lapse of time. So
by now, your antibodies should have been weaned off.
Right.
So it's a possibility that this one will pick up that you don't have any antibodies.
Tell us what the importance to the kind of overall South African bid to deal with corona. What kind of contribution, Ansie, does this make?
With taking in consideration doing all these rapid tests, we can then see how many members out there had the virus, but there were no record of them of having a positive COVID test.
Okay.
And that can have a big influence on our actual cases that we had.
And in terms of individuals, if they find that they have positive antibodies, so yes, I've had COVID, what remains the basic advice to individuals about keeping themselves safe going forward, but secondly, keeping other people safe? Because my understanding is, while there are some patterns in regard to whether you can be infected more than once, the science is as yet uncertain. But you know more about it than me. Fill us in.
From our medical perspective, is you keep on playing and doing what you're supposed to do. So you need to wear your mask, you still need to hand wash, and you still need to do that social distancing. It doesn't, because we don't have evidence at the moment if you can be infected again. I will just continue as normal with all the precautions.
How accurate is this test?
99.9%.
Okay.
My test has done what it's done. And Ansie Hartman, what did you find?
It's non-reactive, so it means there's no antibodies.
Okay, so what does that mean and what are the implications for me?
The implications for you are you still need to be safe, wash your hands, wear your mask, and avoid anybody that has symptoms or expected that they have COVID.
And just to be absolutely clear, I had a positive COVID test at the end of June. This doesn't mean that I had a false positive. All it means is that the antibodies have faded away, which is what the science says that would happen.
Yes, 100% correct.
Okay, well, plenty to learn, and we'll be very, very keen to follow up on this and find out exactly what the medical benefits, what the public health benefits are of developing this knowledge. Thanks very much.
Thank you very much.
News,
Experts,
analysis,
where things stand
what you need to know. Drive home with John Perlman.
on 702.